What if unexplained fatigue, brain fog, pain, or inflammation could be connected to something hidden inside the body? Something that may have been silently affecting the immune system for years. That's what we're talking about today on Wellness by Design. I'm your host, Jane Hogan, the Wellness Engineer, and my guest today is Dr. Robert Whitfield. He's a board certified plastic surgeon and the founder of the Sharp method. It's a structured approach to surgical preparation and recovery that brings together genetics detoxification, mitochondrial health, regenerative medicine, and whole body healing. His work sits at the intersection of plastic surgery, chronic inflammation, immune activation, biofilm research, and biological recovery. He helps patients prepare their bodies before surgery and supports them afterward with the goal of creating safer procedures, smoother recoveries, and better long-term outcomes. In this conversation we're having today, we explore the symptoms commonly associated with breast implant illness, the surprising prevalence of biofilm found around breast implants, and why preparing the body before and after surgery may be just as important as the procedure itself. We also talk about the practical recovery strategies, including Dr. Winfield's simple 3-2-1 method for better sleep, which can support anybody, even if you haven't had surgery. But it becomes especially important after surgery. So if you're new here, hi, I'm Jane Hogan, the Wellness Engineer, and welcome. I'm so happy you found us. On this podcast, we talk about all things to do with pain, with health, with supporting the body's natural healing ability. So if you are a longtime listener, thank you so much for being here and for helping this podcast become a top 3% in alternative health in the entire world. I am so grateful for that. If you haven't already downloaded my free chapter of my book, Pain Free on Purpose, you can do that. It's my gift to you. Just go to thewellnessengineer.com/free chapter and I'll send it to you. Okay, I'll see you inside the episode. Dr. Rob Whitfield, welcome to the podcast today.
Thank you very much, Jane. It's been a long time coming.
Yeah, I've been wanting to have you on for a long time to talk about something that maybe a lot of people aren't aware of. We'll get to that. Let's talk about what you do. You are a surgeon and you remove breast implants. Let's talk about why did you go to that line of work when there are other surgeons are still putting them in?
Yeah, traditional plastic surgery is about putting those in, and I actually concentrate on, taking them out, rejuvenating the breast, doing a natural holistic transformation with the patient's either own breast tissue or their own fat in combination with that. So how I got started goes back to how I trained. I trained in traditional general surgery, so I could do your colon surgery, liver surgery, pancreas surgery, all the things.
Yeah.
And then throughout training, I was looking for the next step, what was going to be what I would be passionate about. And during a research year, I concentrated on microsurgery in a vascular biology lab, and I became very interested in microsurgery and looked about, how could I do that as a discipline? And really, that left you with a couple choices. The most logical choice for me was plastic surgery. Got a bug flying around my face. And the reasons being I could operate on age groups, different types of patients with different problems. Like it could be a lower leg problem, it could be a breast problem, it could be a head and neck problem. It just fit the bill because it gave a lot of diversity and creativity to what you could do. And cancer is a very devastating problem to have. And I always was biased in learning and seeing what led to, I thought, better outcomes. And surgery made sense to me because it resolved the problem to the best of their ability if it was caught early. So anytime anybody has a, a problem with cancer, and Jay, and I get text messages routinely, unfortunately, from friends of ours who have developed breast cancer. So they want to know what's the best practice, what's the best guidance. And obviously, I hope, which the recent message I got from someone was they found it early, which is great.
Mm-hmm.
That makes it easy. That makes it to me, a surgical disease, and that's the best way to take care of it. And that's what they had, and it was taken care of. Now, in the patients who with breast cancer need to have total breast reconstruction, which is what I concentrated on,
Mm-hmm.
using microsurgery. So I'm going to give everybody just a brief, simple microsurgery lesson.
Okay.
Everybody remembers the coffee stirrers at the coffee shop, a little tiny coffee stirrer used to get.
Yep.
So that's about the size of the blood vessel I would sew together. And for something to work, you have to have an artery to take blood flow in, and you have to have a vein to take it out. So when we design a reconstruction, we take tissue from one area of the body, and we'll say for the breast, I use the tummy tissue that would be discarded in a tummy tuck. So that tissue below the belly button, above the pubic hair.
Is it the patient's own tissue?
Patient's own tissue.
Okay.
Yeah. Skin and fats connected to the blood vessels, which pop up out of the six-pack muscle, the rectus, like an elaborate set of sprinklers. But you have to know where to go get the sprinkler, right? You don't want to pick the wrong sprinkler because that's bad. So we would do a preoperative contrast CT scan to look for them. And that would give us the roadmap. Then we'd go to the operating room and we'd separate the tissues carefully, preserve the muscle, preserve the nerves, and take the fat with the skin, associated blood vessels out. So it looked like skin and fat with a little bitty extension cord, two prongs. Here it's the artery and the vein. Move it up to the chest. The mastectomy had already been done. And so we would look for interspace of the ribs and take the rib cartilage out. And there would be little blood vessels there. And it's the same blood vessels the heart surgeons use to revascularize your heart.
Okay.
So we would hook those up. That would basically restore blood flow to that tissue, and that would become the breast reconstruction. And so that has a very special name. It's called the DIEP pre-flap. And nothing's free. It takes a lot of time and effort and resources. So you have to have specialized operating room equipment, very fancy microscopes. You have to have great nursing. You have to have great surgical techs. You have to have all this anesthesia help. And you have to do it in an area that can help take care of the patient afterwards and monitor them and look for problems, etc. So it's a very big, team effort. I wasn't the one person who did everything by any stretch, but that's what I did. Now, you asked me why I take out implants now. So doing breast reconstruction that way led to patients being referred to me that had breast cancer reconstruction with implants who then develop problems, whether it's an infection, a capsular contracture, which is a hardening. That can be from infection. It can be from radiation treatment. It can be from time or other reasons or whatever. So all these people would get sent to me, Jane. And as a new plastic surgeon in practice who did all this really what I would say at that point in 2012 was cutting edge type things in terms of reconstruction. I was solving problems because I just thought, your thymus teaches your T cells to recognize self.
Mm-hmm.
And when you use your own tissue to correct a problem that's caused by a foreign body, in essence, it can't be rejected.
Right.
Because your T cells can't reject your own tissue. So as long as I did my job properly, I hooked up blood vessels, I
Mhm.
cleaned out the scar tissue and any associated problems. Even if there was an infection, Jane, you now had a new source of tissue that would help, if you will, treat the area, rejuvenate the area, heal the area.
So the body kind of takes over on does that work? The clearing up
Yeah,
the infection itself.
yeah,
Amazing.
yeah. I often, and so for everybody listening, you can heal if you have enough oxygen. So it's very important for all y'all listening who don't think sleep apnea is a problem to get tested. Because if you snore, and a lot of women don't snore, but if you wake up with brain fog, gasping in the middle of the night, all these things, that's your brain telling you you're going to die, and that's why you wake up. Right? So obstructive sleep apnea is a real problem. I wear a CPAP mask. I'm not ashamed to say that because I value my brain. It's very important. And I want to see my kids grow up. I would like to be a grandfather. And I want to be aware of my surroundings and cognitively, there. So it's very important to me. So if you have enough oxygen,
Yeah.
you can heal. If you rest enough, you can heal. If you concentrate enough on your nutrition with the appropriate amounts of protein and fats, you can heal. I don't mention carbs because they're not important to me in terms of healing. If
Mhm.
you have the appropriate level of supplementation, vitamins, especially methylated vitamins, vitamin D, glutathione, vitamin C, trace minerals, you will heal. If you're free from infection, you will heal. Like, these are just fundamentals. They're not that complex. It may sound like a
It's
lot.
it's a miracle, but it is basic as well. It will
Yeah.
happen.
If you give your body what I just said, you will overcome whatever it is. You will at least be on the right track. I guess I shouldn't overpromise here, but I'll just say those things allow you to allow your body to do what it can naturally do. If you just get out of the damn way, it will do all the right things.
Mhm. Yep. So the implant. So these women that come to you with infections or something's happened with this implant,
Yeah,
it's kind of running interference then, right, with the natural processes.
100%. Like the way you're taught is it's a foreign body reaction, right? We get a splinter
Yeah.
in our finger and it creates a foreign body reaction, and then your body walls it off. Well,
Hmm.
it's not quite that simple. So, I got into that discussion because I took care of patients with implant problems from cancer. And infections were really detrimental in cancer patients because they're receiving therapies that immunosuppress them. So every time someone gets chemotherapy, their defense mechanism is unavailable to block what it would otherwise be able to take care of. And it's much easier to get an implant based infection when you're on chemotherapy, which I dreaded Friday, Saturday, and Sunday because it seemed like those were the times I got called with those patients being in the emergency rooms having cellulitis or redness or infection. And they'd say, well, she's here. She's not doing well. She's in the middle of chemotherapy. And I was like, well, you have to admit her. You have to give her IV antibiotics. And if that doesn't resolve, we have to operate on them, typically within a day or two, because it's not going to get better. They're going to get sick and potentially become septic. So,
Hmm.
I never really took much solace in having a patient who had an implant-based reconstruction because I was always worried about it for those reasons, like getting infected in an immunocompromised patient. So, and every patient who
Mm.
has surgery is immunocompromised, but then when you give them chemotherapy, it gets obviously markedly worse.
Right.
And, fast forward to all these cases I do. So, cosmetic cases, normal patients, they shouldn't be immunocompromised.
Right.
So, how does that happen? Is that a thing? Can you get an autoimmune disease? I get all these questions like all the time. Like this is just constant. And so,
You're getting those questions when someone comes to you and things have gone wrong with their implant. So these aren't your
yeah,
cancer
it's pretty
patients.
standard. Like they want
Yeah.
to know, can I get an autoimmune disease from an implant? And autoimmune diseases predate implants.
Hmm.
I mean, the first autoimmune diseases were diagnosed in the late 1800s. So implants were placed first, not far from me. I'm in Austin. They were placed first in Houston, Texas,
Really?
1962. So, okay, we'll just say they don't necessarily, quote unquote, cause them. But you go, your HLA type, how you eat, how you live, air you breathe, food you eat, things you put on your skin predispose you to all sorts of problems.
Yep.
So, chronic inflammation is basically how I think of this. And there's lots of, you know, other disease states or other problems that cause chronic inflammation. You can have Lyme disease, you can have long COVID, you can have a parasitic infection, you can have a bad mold exposure. You have all these things
Yeah.
that lead to basically the same set of symptoms. So then, like, what's the difference, right? Okay, well, all my patients come to me because they have implants. And all of my patients typically have gone through extensive medical workups that have revealed absolutely nothing. So, what's causing what? So, when we explant them, we find that 29% of them have bacterial contamination on their implant. So,
Ick.
once again, right? So, it's not traditional infection, but it's there. So, I think the traditional,
That's 29% have
yeah,
that.
out of 694 consecutive samples, I've published the largest series in the world on that. And so, people say, like, oh, that's, you didn't compare that to normal breast tissue. Okay. Well, normal breast tissue doesn't have a breast implant. Why would I compare it? Right? It wasn't in the breast tissue. It was up against the implant. That's what we tested.
Mhm.
So in 2024, we published that. In 2024, a scientist published an experience that shows that those bacterial contaminants, particular staph epidermidis, interacting with your breast tissue, the fatty acids in the breast tissue, oleic acid in particular, causes oxidation. We know that oxidation is bad. We want to live in a reduced state as much as possible.
Yeah.
The more oxidative stress, the worse that is for us. Like, everybody would agree with that. So it creates this oxidated lipid. It's called oxylipin 10 hub. Now, if you just track that through the system, there's a lot of things that happen. Ultimately, it causes macrophage polarization, which leads to more symptoms in patients. And so, okay, our patients come in with inflammation. It's chronic in nature. They have a device in place. They've done all this other workup. And we look carefully at genetics and toxicity burden, gut health, food sensitivities, and hormone balance in my program preoperatively, because I don't want to operate on someone, do their explant, and then, them not get better. So we want to make sure we screen and identify as many levers that we can do or that we can pull to help them as possible. So I think it's incredibly important that you look carefully at anything that we have access to help. So that's the way the programs is ran. That's why I wrote the book about it. And anybody, it's out there for everybody. I'm not hiding the program. Like, the program's accessible to everybody. So
And
what do we find?
that's the recovery program after the surgery, or is it a prep
So
program
my
before the
patients
surgery?
started before surgery.
Yeah. Okay.
Yeah,
That makes sense to me.
and you can run it anytime, honestly. But so many people, Jane, rush to get stuff done, and many times I just have to have them slow down a little bit, because knowing what I know about this, if you just remove a device with a capsule, which we always do, it doesn't always solve the problem.
Hmm. Why,
And those
do you
ones
think
that
that
are
is?
because the ones that are infected will get relief right away. That makes sense. The ones that are breaking down chemically and leaching chemicals into your system, like heavy metals, those people get better right away. But then there's this whole group of people that wouldn't, because they're suffering more from chronic inflammation.
So the inflammation has gone beyond just where the implant was. It's
Systemic
throughout the body.
inflammation. Yeah. Yeah.
Systemic. Mm-hmm.
And they have other drivers. We've done over 500 tox tests with Vibrant Wellness, and the audit shows that the number one problem they have is BPA. Number two is glyphosate, big shock. Number three is aflatoxin.
What's the third one?
Aflatoxin, mycotoxin.
Okay.
It's mold.
Right. And so the BPA comes from plastics,
Mm-hmm.
cosmetics,
Mm-hmm.
right? So many different things.
Yep.
Um, the second one you said glyphosate, so that's what's sprayed on a lot of crops, and then
Right.
also in the feed that the
Right.
animals are eating, and then you eat
Right.
the animals, and then the mycotoxins. So they're getting that like out. That's coming from outside of the implant, but they're exposed to that, and that's making the situation worse.
Correct. So if you just think of, and you have a lot of people you interact with that don't detox. Like most people don't understand what that means. So genetically, if you have a really poor vitamin E pathway, so vitamin D is incredibly important in your entire body. Now, levels to me of vitamin D, they don't really tell the whole story.
Hmm.
You have to convert D2 to D3. You have to then transport it, and you have to uptake it into a cell. We don't really
And
measure those
vitamin D is a
things,
hormone too. I mean, it's not even really a vitamin, right?
right? So there's a lot going on with vitamin D. And people ask me, like, what should I be doing? The way we have over the last, if you will, 6 years adjusted our supplement stack, it's to give D3K2 in a liposomal form, to give methylated B in a liposomal form, to give glutathione in a liposomal form, and to give vitamin C in a liposomal form. And everybody's gonna be like, why do you want to do all that, Rob? Well, those are the things that matter the most for detoxification and reducing oxidative stress and for healing.
Hmm.
The other things we add a little mag powder, a little carnitine, like simple things to help with further detoxification, support. And I don't want to give people tabs and capsules because people can't always swallow them. They have difficulty absorbing, breaking it down.
Yeah.
And I already am going to put you on a very high protein diet. Once again, I said if you get enough of the right nutrition, your body will heal. So, in order to get out of a high cortisol state after surgery, your body has to recognize you're in a positive nitrogen balance. And if it can't do it, if it never gets there, you stay in a high cortisol state. You're really overstimulated, you're anxious, you're swollen. All these
Right.
things happen. And it's really important that we drop that as quickly as possible after surgery.
And it's the protein that makes that
It's
happen.
what tricks your brain into, oh, I can heal now, right? We said if you give it all the things it needs, your body
Hmm.
will do the right things. But if you don't, it can't. The body
Gotcha.
can't do what the mind won't let it.
Yeah, I know that.
So if you don't give it what it needs, here's a good example. Everybody in your audience has had either exposure to or personally a procedure done. Now, given the depth and scope of the procedure, surgery, afterwards, there's a recovery phase. Even the smallest procedure can cause this problem. If you don't consume enough dietary protein, in the afternoon, you will have to go take a nap like you're a baby. So, why does that happen? So, your body's extremely clever. And babies eat, sleep, eat, poop, pee, sleep. That's all they do. They grow.
They're also
That's
growing, so they
that's the
need,
game, right? They
yeah,
need all these calories, and they sleep because you only recover when you sleep. You only
that's
can
a good thing for
recover.
people to remember.
Yeah, you only can recover if, in fact, you have enough nutrients enough protein, we'll just say, I'll just concentrate on that macro. We're just going to have you remember one macro this entire discussion. Your body will recognize that, and it sets off a whole series of reactions. Your gut, which is going to be the centerpiece in this whole progress that you make, has to break down those proteins. And people tell me all the time, Jane, I can't eat that much protein, Dr. Whitfield. I can't do it. I can't do this. I can't do that. And I have to, Jane, every day in my clinic, have this discussion. If in fact you do this, you'll feel better, you'll recover faster. And just today, I had this lady. She's in her 60s, and people come in a lot of nutritional depletion because they don't know how to eat and take care of themselves, and they're worried about things, and it doesn't serve them.
Well, they're stressed, so they're probably not even absorbing what they are eating very well.
Right. And they find ways to navigate around doing that. It's a weird thing in my world. Like, I'll tell you what to do, and you'll try to tinker with my philosophy. And my philosophy is based on just your body. It's not, I came up with it. Your body uses that philosophy every day to keep you alive. It's not mine.
When you say a lot of protein, like how many grams are you talking about in a day?
Minimum of 100.
100 grams of protein. Okay.
Minimum.
And is that for people like recovering from surgery or just in general?
Yeah, I think it's different, right? So
yeah.
If you're a person who really, really does better on higher amounts of protein, your set point's different. So I just set points based on what you already do. The people who have the most trouble, and once again, for everybody listening, I don't care what diet you have. I don't care what you eat. But when you come to see me, if in fact you come to see me, I'm going to give you some very specific instructions. Whether you're a vegetarian, vegan, pescatarian, carnivore, I don't care. You need to get enough protein in. And if you don't, you'll stay swollen longer. You'll feel anxious longer. You'll have more trouble with energy levels. You'll have to sleep in the afternoon. You'll have to take like an hour or 2 hour nap in the afternoon. Like the tell every time somebody's struggling, my patients, it's very obvious. My staff come to me and go, oh, she's not doing very well. She's having a tough time. And we'll go in there and like, okay. What, the simple question is like, how do you feel? And, if they, if they don't right away say pretty good, you kind of know that it just is going to boil down to me having the same discussion that I always have to have. And I don't know how to explain it any simpler. If in fact, and you can do this starting today, concentrate on your sleep hygiene, your entire world can change.
It's true.
Because everything that's restorative actually happens when you're asleep. Nothing restorative happens when you're awake. Stress happens when you're awake. Physical exertion happens when you're awake. Mental strain happens when you're awake. At night, if you can get long enough, deep enough, high enough quality of sleep, the lymphatic drainage of your brain will wash out the trash from the day.
Because that only happens when you're sleeping.
Correct. And the lymphatic system will drain the rest of your body. If, in fact, you wake up and you feel worse than when you went to bed, none of that happened. If you're the person who has to get up in the middle of the night to pee who's female, you need counseling. You should not be doing that. You have too much cortisol release. It's just waking you up. Or you're drinking fluid or wine before bed, which is like classic behavior, right? You're trying to unwind, so you have a glass of wine.
I just want to interject there because I hear a lot of people, a lot of women that I work with say they're getting up at night to pee. Oh yeah, I just get up at night to pee every night. It's just, normal. So first thing is to cut out drinking wine or drinking liquids in the evening. Secondly is what? You just
Yeah, so the way we do it for patients, because we have very, very big asks. Like when I ask a patient to do this, you have to be fully committed to this. So you need to stop eating 3 hours before bed,
Mhm.
stop drinking 2 hours before bed, get off your screens, tablets, whatever garbage it is you do before bed, and try to get in the frame of mind of we're going to go to sleep and we're not going to get up to go pee because you're not a male with a prostate that's the size of a grapefruit. Now that's a problem.
Mhm.
Females, me, it's like fluid too close to bedtime, alcohol too close to bedtime. Like those things are just acting as reasons to then wake you up, so you have to go to bed. It shouldn't happen.
Mhm.
And so you have to get the room cool enough. Now, women need a different temperature than men, obviously. And if you have a sensitivity to noise, you need to play some white noise or wear some, whatever headphone that aligns with your beliefs, uh, to block noise. Like I have to wear
Yeah.
headphones because I have, two kids. I have a wife. We have a blind pug that wanders around stomping on the wood floors. So, and I wear a sleep mask. So, and a CPAP mask. So I look like a freak when I go to bed, but I don't.
Do
I don't
do you
really
tape your
care.
mouth as well?
No, because it's harder for me like to get enough oxygen just through my nose. So I have a mask. So, you
Oh,
know,
yes, you mentioned earlier, yeah.
yeah, I would if I probably could get away with it, just mouth tape, but I can't. It's seemingly like sometimes I wake up and I don't feel very good. So that's to me, I'm not getting like enough, either uh oxygenation or there's something going on. I don't know what. And I haven't been willing to retest uh my sleep apnea because like I know I have a pretty bad problem with sleep apnea. So I'm not like it's not just resolved. It didn't
Mm.
go away. And I'm not overweight. I don't have like a weird, problem with my neck. It's just I grinded my teeth for a long time operating. So I had to have my teeth height restored and then have a little bit of a narrow airway. But every night I go to bed typically between like 9 and 10. I don't deviate.
Right.
And so I get up between like 4:30 and 5:30 every day. And,
Certainly.
I know what my HRV is. I know how long I've been in bed and I get up and I'm consistent. It doesn't really matter what day of the week it is. That's what I'm doing.
Mhm.
And that just helps. I don't do a good job of going out and getting sunlight in the morning because I'm usually at work before the sun's up and I don't break and go out all the time and walk around, which I should, but I don't. So I could do better like that. That helps reset your circadian rhythm. And then
Yep.
when you're after surgery, you cannot fast. So you have to get out of that habit before surgery. It's not the time to start a new habit after surgery. It's one to start before you ever go through the process. So if you're fasting, um, you need to get into a habit of eating and responding to that satiety level and then going throughout a day because it's like GLP-1s, Jane. Everybody's like obviously using who needs them, but then I have some people just microdosing, do all these other things. So I tell them like, look, you can't do that and have me operate on you. Why blah blah blah. I'm like, because I need you to be able to eat.
And know when you need to eat.
Right, right.
Yeah.
Does that I try to do things that make sense, right? Like just think. Like
Mm.
if that drug burns fat and makes it so you're not hungry and you think that you're full, that doesn't really work for me.
Mhm.
And the anesthesia guidelines are you got to be off at 2 weeks, which is to me not enough. I always give people like I want more runway, not less. Everything
Right.
I do, I want to be. I have to be, I'm a micromanager basically. If the stuff I know what works, I don't, you know.
And you want your patients to have success from the surgery too, so you want to set them up for that.
Yeah, all those drugs work really well. Like, I never thought there would be a drug that changed behavior, and then this one comes along and it
Mm.
changes behavior. So, any drug that changes behavior is by far the most powerful drug you could ever have. So anything that controls binge eating, addiction, lowers inflammation, burns fat, all these other things that we don't even know it does yet, which I'm sure will come to light at some point. That's a pretty powerful tool, and it should have a lot of respect.
Hmm.
So I don't really want you on it if you think um, I'm your surgeon. Basically, it doesn't. You know, it works too well. It's not like
Hmm.
taking a blood pressure medicine. It's not like taking not a blood pressure, a blood thinner that we can turn off and on very easily. This is a very powerful tool that changes your perception of what you're doing. So I don't,
Hmm.
yeah,
So you have a process before and
yeah,
after surgery, which incorporates a lot of lifestyle things, which are really within someone's power to do. But
yeah,
these things help set people up for success.
yeah. I think most of us have some pretty poor habits. So most of it's just trying to
Hmm.
make a series of small changes that have a cumulatively large effect, right? Tiny habits and just
Exactly what I teach.
change the little ones, and the
Yeah.
ones that people fight me on, this protein thing, you would think I'm trying to kill them or something with protein.
Hmm.
Like, it's the
So
most important macro.
you were saying earlier, I think when we started on the sleep topic, that you need to, in order to sleep better, you need to get enough protein. Was that the correlation, or did I get that wrong?
Yeah, so think of it like this. Like, why do babies eat so much and sleep so much, right? So if we're and I'm sorry, you highlighted why, because they need to grow. And you do all this growth, they have all this growth, but it's because they consume all these calories and then they rest. If we want to think of it, the parasympathetic state is rest and digest, right? The sympathetic state is fight or flight. So I cause sympathetic activation. You've probably never interviewed anybody who causes more than I do,
Because of the surgery.
right? So our job is to get you prepared and in a lower cortisol state before surgery, because I'm going to cause a big burst, and the
Right. So,
longer you stay in it, the worse it is.
so you, in terms of like a bucket of how much we can take, if they're already high, then you're going to do a whole lot more. So you want to bring that
Right.
down before surgery.
Right.
Okay,
And all my
makes sense.
patients are high already, right? They
Yeah.
already have a
So many
lot
people.
of chronic inflammation. Right.
Yeah. Yeah. And they've got, your patients have the inflammation as well.
Right. Right.
Right.
Because
Uh,
you can have the exact same problems that I deal with and not have implants. We've all seen these patients.
Chronic inflammation.
Right. So that's why, like, okay, so anybody can have that problem. I gave you the reasons why. It's genetics, exposure, poor gut health, sensitivities to all sorts of things, poor hormonal balance, also can be attributed to genetics, also can be attributed to diet, also can be attributed to products you apply to your skin. So you have to be super diligent. Everybody listen. You have to be super diligent to the fluids you put in your body, the quality. Like, think of like filtered water, the quality of the food to the best of your ability. It's very hard. And then everything you put on your body. And
Hmm.
women use the most products by far.
Most
And
chemical
then
exposure.
the number one thing is BPA. And BPA has been around since the 50s. Introduction of plastics into the US economy, basically. That is very problematic. So just
Yeah.
scrutinize what you put in and on your body.
And for people that might think, well, it's all around, nothing I can do. I mean, you can do something. You can
Yeah,
mitigate.
that's a very significant cop out. I don't I don't I don't want to hear that. Don't come into my clinic saying that stuff.
Yeah. Okay, so and you mentioned when you were talking about that supplement regime that you do, I
Yeah.
kept thinking about high school chemistry and those long chemical, well, you need this needs to go in, this needs to go,
Yeah.
all these things need to go in to make this
Yeah.
reaction happen. But you said something there, Rob. You said like the form form that you give it to them is not capsule. It's not
Right.
a capsule format. So what format is it, and why is that helpful?
Well, just like we go back to the babies, we don't give any babies capsules. Right? It's always liquids.
Yeah.
So liquids, and these are liposomal, so you can absorb them in your mouth. So many of my patients have tons of problems with constipation, diarrhea. I'm sure, you have a group here who faces similar challenges. And, I can't resolve all that to surgery.
Hmm.
I would say gut healing is by far the most difficult and takes the longest. I have a group so we should highlight this now. So there's two ways that our patients are taken care of before and after surgery, if you will. So there's a surgical path and there's a detox pathway that runs for all of my patients. And they're running my program if they're engaged with us. So my surgical pathway runs as it would normally: consultation, preoperative assessment, the surgical plan, the day of surgery, the day after surgery, and the week of surgery you spend in Austin with us to, get your recovery started on the right track. But all of that really is meant, or to say, starts when we meet you and get you started on the program. So
Hmm.
the supplementation starts back then, counseling on nutrition starts back then, the testing starts back then, and I have a detox team that just works with those clients, and they try to help get everybody on the right track and identify high mycotoxin levels. So we have a program for folks with high mycotoxin levels, because that used to be a real challenge for us, but I no longer feel as, you know, I'm always concerned about it, but I'm not intimidated by the whole mold thing anymore. The parasitic problem, the Lyme problem, the like long COVID stuff, like that's far more like aggravating, because it's
Hmm.
hard to like ferret out all the causes and get you a plan. So especially parasites, and it's really frustrating to me. Um,
Pesky things.
yes, and those things run in parallel. So we have surgical planning and follow up. We have detox protocols, planning and follow up. And I think it's a little confusing because people think I cost a lot of money. Well, I have a big team that takes care of everybody, and a full time functional medicine program that runs alongside my surgical recovery program. So uh, basically, just so everybody understands it, when you come to us, you don't need to go see somebody else. All the things that need to
Mhm.
happen are going to happen outside of something super subspecialized. Like if you have a specific thyroid problem, I don't take care of it. But we handle and take care of the functional medicine aspect, detox aspect, nutritional support, and supplementation support, all the things outside of the surgical purview of a normal practice that's run through a functional medicine practice, we take care of. And then we also have a couple $1 million worth of equipment in the office to help you get into the fastest, most efficient recovery state possible, with hyperbaric therapy, with lymphatic massage therapy from New Zealand, nano-V therapy, red light therapy, the human regenerator from Germany, which is probably something nobody or very few people in your audience probably know about. The human
I don't know
regenerator,
about that.
yeah, it's an interesting tool that gets you into a more parasympathetic state, and it just uses cold plasma to help electron transport. That's probably the best way to do it.
Hmm.
And energy-based therapy to help electron transport.
You got a lot going on there to get people into recovery mode and healing.
Yeah, and people like stay extra time with us. Like I would say, Jane, everybody's in a rush, right? This is always the case. Like they want to come in and out and get on with everything. And I don't disagree that that would be ideal. But if you've had a problem for 20 plus years, it's going to be hard for me to solve it in 2 to 3 hours of surgery and a week in my office.
Yeah, that makes
I mean,
sense.
if you give me a couple weeks or a month, I've had patients stay 2 to 4 weeks.
Mhm.
Then you really see in person how the change happens more easily. we cut people slack. We understand they got to get back. They have businesses, families, all the things. And it's the folks who I know it works really well because I see it when they stay just a little bit more and or they come from out of the country. All those folks stay a couple weeks. I don't let them long haul it, back, a week. That would make no sense. And you really see like they get to the other side much easier because they're there a little bit longer.
And they're having support to make these lifestyle shifts that are necessary.
Yeah, it's hard to ignore me. I'm like a bad penny. If I keep telling you the same things, eventually you'll hear them. And the more you can hear them, it takes a while, obviously. And it's not like nutrition is some imprinted system we have, that we can just go back and draw from. We may have not been taught anything. Like, I get that. I just say, look, I don't care what your diet is. I have a plant-based protein with minimal ingredients that we know works. It has a good protein score. So the vegans, the vegetarians are fine with it. I basically have to have one size fits all for that. I can't have 9 different types. We have another one that we added called Primal that's more, animal based. But I like it. Once again, I'm Switzerland. I don't care what you diet you do. I don't care. Doesn't matter to me.
You
just have
just
to
need
get enough
that level
protein
of
in.
protein. Yeah.
Yeah.
So Rob, people come to you for this surgery, they need to be there a period of time before. What's the minimum period of time beforehand?
Well, we get all the work done remotely initially, and then they
Okay.
typically fly in the day before.
Okay.
If you can fly in a couple days before, that's nice. But traditionally, people come in the day before. We see everybody in the office. We go over all the details, make sure everything from a planning standpoint is done, and all the paperwork, of course. Because what would a day in the life be without paperwork? And then the following day is surgery. So tomorrow I'm operating, and then everybody comes to the office. I think it's critical to understand our program. Like the way I was taught, you operate on somebody, you saw them in a week. And the way we do everything now is we operate and then we see everybody the next day. And I get everybody started on what you need to recover are the following. You will recover if, in fact, you get enough sleep, you get enough oxygen, you have enough nutrition, you fill in the gaps with supplementation. And what we do to help maybe kind of some shortfalls in some patients is enhanced lymphatic drainage.
With some of the equipment you have there.
Yeah. And we're really, Nano-V helps with protein synthesis. And the red light helps with, as we know, lower inflammation, helps with hormone balance. Like, there's a method to all the madness. Like, none of it's without a reason. And the more they do that, the more they commit to the process, and especially on the dietary side, boom, people just get doing better and better and better. And they're like, oh, I feel a lot better. And when you hear that, you're like, well, then the patient switched into positive nitrogen balance and they're getting enough rest, because otherwise they wouldn't feel that good at 3 or 4 days after a major operation. They'd still be laid up at home taking narcotics, which aren't even really part of our program. We have all these local and regional nerve blocks we do, and we have long-acting local anesthetics. So we really focus on all these other aspects to enhance recovery, decrease the need for any, narcotic-based pain medication. Now, some people need some. That's fine. I don't care. Whatever you need, you have. And then, I've had people not need any, and I've had people, occasionally need a refill. I don't care about that either. All I care is that you have what you need and the time that you need it, and then you get better. Like, everybody's different. Everybody's a bio individual. So, like,
you're working with them.
Yeah. I mean, come on. Everybody's different.
So, Rob, I think what I've learned from what you've been saying is it's not just, come in for the surgery and be done. People come in with a and to your team and you've got a success plan for them. So they are in good hands. What I want to kind of shift to now is how would someone, just say someone's got breast implants and they're hearing this and they're like, what? How would I even
Yeah,
know if I had
yeah, sure.
breast plant, BII, breast
Yeah,
implant illness, right?
yeah, yeah. I think it's a tough question, right? Because I'll say this, and you'll probably well, hopefully nobody gets mad at me. I think women are far more resilient than men for a number of reasons. They tolerate pain better,
Well, it's true. We
and
kind of grew up with it, right?
yeah, and they don't complain about stuff. They just kind of because they deal with the kids, they deal with their jobs, they deal with businesses, they do all this stuff, and they just cope with a lot more things.
And they put
And be
themselves last very often as well.
Yeah, and all that cumulative stuff, it takes a long time for somebody to notice they just don't feel well. So finally, when they don't feel well, that kind of raises some red flags, and they'll start looking into it. They may have like some, early signs of Hashimoto's or some kind of early sign of an autoimmune problem, and they may have like constipation is very common, just like being tired is very common.
Mm-hmm.
All that stuff's super vague.
Yeah, really vague symptoms.
Yeah, you go to the GP and the GP doesn't know what's up. They put you on like Zoloft or some shit, and then that's not helpful. That didn't do anything. So that kind of just leaves people asking more questions. And the way we develop, and anybody can listen to like one of the 180 podcasts I've done. I take just a very I try to be really pragmatic, right? So you look at everything because by the time someone gets to me, they've already gone through blood tests, all these doctor visits, and you should have a medical workup in that you want to make sure something's not getting missed. It could be problematic.
Mm-hmm.
But if in fact nobody has answers, um, then that's, for me, I just really listen to people and how they detox. Like you can tell people who don't methylate well, you can tell people that have a lot of problems with mitochondrial function, their
How
antioxidant pathways.
how can you tell?
My patients will show up with really unrelenting fatigue that keeps you in bed and doesn't
Okay.
let you get out. Now, if you got one of those two problems, you got one or two things in my head that are genetic problems. Your SOD2 pathway, which is your antioxidant pathway, is super limited or overwhelmed. That's one of the main things.
Mm-hmm.
And or you've had an incredibly bad mold exposure untreated, causing a lot of mitochondrial dysfunction.
Mm-hmm.
All you add in is the other, in our patients, 83% of my patients have genetic mutations in their vitamin D pathway, in the methylation pathway, in the granulation pathways, and in their antioxidant pathways. So I get the same avatar all the time. They're self-selecting and coming to me because they haven't gotten the answer. Before we got on this podcast, I was talking to somebody in Brazil, and it's clear that a workup that's a little bit more focused on genetics and a more in-depth approach to toxicity burden would be helpful in patients because patients from all over the world still have the same problems. They're just getting the doses in different ways. Like
Mm-hmm.
Monsanto has sprayed Roundup in South America. So I
Well,
told this patient, I was like, you need to have a glyphosate level. They're like, well, we didn't live near agriculture. I'm like, you ate it, right?
mm-hmm.
So what's the chance that this person doesn't have a high glyphosate level?
Mm-hmm. Do you know
Especially if I'm saying she's my avatar, right? She
yeah.
said she explanted, but got worse. Now I can tell you, Jane,
Mm.
that doesn't happen in my practice. Why? Because we look at everything up front.
You do all the other stuff.
And so I know
Yeah.
when you got problems up front. And we start working on them up front. We don't You can never, ever in this patient population, in my opinion, react to the problem after the fact.
Right.
You should identify as many of those problems up front, counsel the patient up front, really get them on the right track up front, especially if they have mold. Especially if, like, I had a lady had Giardia, undiagnosed Giardia. She's having diarrhea for 2 years.
Oh,
And I'm like, what person doesn't know you? Because I listened to her for like, I don't know, it was like 10 minutes. And I was like, I looked at my nurse practitioner. I was like, sounds like she has Giardia. Am I missing something? She lives in a community. She lives on a lake. And she's had diarrhea for 2 years. Like, sounds like she has Giardia, unless I'm missing something. Did anybody test this? And she's like, no. And I'm like, you live on a lake and you have diarrhea and nobody checked you for Giardia? Or like, is critical thinking gone now? Do we just not like worry about that? She had a colonoscopy, by the way. I was like, well, that's not going to help. Colonoscopies aren't the cure for Giardia, right?
yeah.
That's just stupid.
So Rob, I haven't had implants, so I'm not concerned about it. But I know in
Yeah.
my audience's demographic, there are many people that may have. And so if you've been listening to Dr. Rob and you just heard about some of those symptoms, you're a little bit concerned. What should people do next?
Yeah. So we tore down our entire website and built the most comprehensive website in the world for breast implant illness. And so you can
Okay,
go to
excellent.
drrobertwhitfield.com. We'll make sure you have the link in the show notes.
Yep.
And because I get censored and banned on platforms that used to be very kind to me, we created a private community that I live stream from on Thursday nights. It's called drrobscircle.com. It's also accessible from the website.
Okay.
We have our podcast. We still do the Dr. Robert Whitfield podcast now is how it's named and found on YouTube and Spotify.
So there are resources for people.
Yeah. Yeah.
And we will have links to those resources. And, I can just tell, Rob, you are putting so much effort and time and even with being banned, I'm like, why would they ban it? But I guess there's someone making money by you or not making money by you doing this. Right? That's always a thing that can happen. So you're putting all this time, energy, resources into educating people on this so that they don't have to be sick. And I mean, I know that comes from a huge heart. So, that's fabulous. And thank you so much for that. Is there anything big thing we've missed that you want to make sure people hear?
Yeah, I think the stuff that is accessible to everyone is paying attention to what we talked about sleep. Like, first and foremost, I prioritize sleep above everything else. I've said it on numerous podcasts of my own, shows I've appeared on, and people really, for lack of a better word, sleep on sleep. Right? You need to pay attention to sleep because everything that happens that's really from a restorative standpoint, from a recovery standpoint, happens when we sleep. So if you don't get good sleep, you really start by examining why you're not getting enough rest, enough restorative rest. And, not to agitate anybody, but there's lots of ways to track or not track rest or assess rest. And if you just do the 3-2-1 like we talked about, and if that doesn't stop you from getting up in the middle of the night to go pee, then you just adjust the last time you drank some fluid, and you really get that part solved first. That's actionable. Like, if you want something actionable from our discussion, concentrate on your sleep hygiene. It is absolutely free and the most important thing you can do.
Well, the question I usually ask is, what's one thing someone could do today that's going to shift their body into a healing state? I think that's your thing, like prioritize.
That's it. That is it.
That is it.
You do that, you'll make the biggest dent in what's problematic for you. If you can't do that, it's really not for us, it's a deal breaker. And I have to have this discussion every single time with every single patient. Every time I have somebody struggling, it always goes back to the same discussion. Like, You have to get enough protein in your diet. And there's
Mm-hmm.
tricks. So when I say 3-2-1 and your last meal is 3 hours before bed, and I say your last fluid intake is 2 hours before bed, try to make the fluid intake a little cheap. So you take 8 ounces of filtered water, not out of plastic, preferably out of glass or some filtered system. And you mix protein in it, either froth it up, blend it up, I don't care, choke it down. Why? Because that's what your body craves in this process that I'm talking about after recovery. And then you go to bed. Think of the baby. You fed the baby took a big nap, right?
Mm-hmm.
Baby wakes up, got to poop, pee, get some more food. You wake up in the morning. What do I want you to do? I want you to repeat the last step before you went to bed. And here's your, if you will, pat on the head for doing a good job. You can add an electrolyte packet to your protein water, right? There you go. People overuse electrolytes and they overuse amino acids that are powders or liquids. So protein can't be peed out like that. It has to be broken down into its components, which are peptides, which are amino acids. So that's the hack, right? That's the take home. Fix your sleep and get more protein in your diet. If you do all that, maybe you never have to come see me.
Hmm. So what we're doing is like it is shifting the body over so that it's got what it needs, the basics, sleeping at night, enough protein so that it can deal with some things. The body is amazingly resilient, but we need
Yeah.
to give it support. Rob, this has been so interesting, so enlightening. I know we're going to have the link to your website there. Also, a link if people were interested in those, your
Or
anti-inflammatory
supplements. Yeah,
supplements. We'll have that link there as well.
sure.
Um, just thank you so much for being here today, for giving up more of your time. I know we had to work around your surgery schedule, so thank you for doing that. Thanks for being a guest today and sharing this body of knowledge that you've got with everyone here. So thank you.
Thank you for having me on. Appreciate it.
And to the people watching and listening, if you or someone you know has had a breast implant, you're concerned, you've listened to this, and maybe there's other things going on, these what we think are like mystery kind of symptoms, tune into Dr. Rob and learn from him, and then just go from there. There's so much you can do to support yourself. Okay, thank you everyone for being here on Wellness by Design, and we'll see you again next week.